Another movement that produced outsized benefits was walking backward. At first glance, it seems almost trivial or even silly, but neurologically, it is anything but. Forward walking is automatic. Your brain has been doing it for decades, with minimal conscious involvement. Backward walking removes that automation. The brain can't rely on habitual patterns and must actively process each step. This increased demand forces the nervous system to form new connections related to balance, coordination, and spatial awareness, starting slowly in a safe environment, such as a hallway, and lightly touching a wall for guidance. Older adults practiced taking deliberate steps backward. What emerged was a noticeable improvement not only in balance, but in forward walking itself. Stabilizing muscles around the knees and hips, often neglected in normal walking, were reactivated. Participants frequently reported feeling more aware of their body position and more confident in their movements after only a short period. This wasn't about conditioning or endurance. It was about waking up dormant systems that still existed, but had stopped receiving meaningful input. A third movement borrowed from something many people did naturally as children: walking heel to toe in a straight line. Though it looks simple, this movement challenges nearly every component of balance simultaneously. Vision, inner ear, input, joint position, sense, and core control all have to cooperate. Performing it correctly requires standing tall, keeping the eyes forward rather than looking down, and placing one foot directly in front of the other so the heel touches the toes. This narrow base of support exposes weaknesses that normal walking hides. As difficult as it can feel at first, it trains the body to maintain stability in situations that closely resemble real life, such as navigating tight spaces, uneven surfaces, or crowded environments. Over time, improvements in this movement translated directly into better balance during daily activities. What made it especially valuable was that it didn't isolate one system. It trained integration, teaching the body to coordinate multiple inputs at once. The final movement turned out to be the most powerful of all. It involves standing on one leg while slowly reaching the other foot in different directions: forward, to the side, behind. Each reach required the body to shift weight, stabilize, and then return to center without losing control. This single activity demanded constant adjustment from the nervous system. Balance was no longer static. It became dynamic, responsive, and adaptable. Researchers observed that this movement activated more muscle fibers and neural pathways than many traditional balance exercises combined. Practiced near a support for safety, it allowed individuals to challenge themselves without unnecessary risk. Over weeks, participants didn't just score better on balance tests. They moved differently. They stood more confidently, reacted faster to perturbations, and reported feeling less anxious about everyday situations that once made them uneasy. The reason was simple. This movement closely mimicked the unpredictable challenges of daily life, such as reaching for objects, stepping over obstacles, or recovering from a misstep. The body wasn't just exercising, it was rehearsing survival-relevant patterns. What became increasingly clear across studies was that balance loss was not a passive consequence of aging, but an active response to reduced stimulation. When specific systems stopped being challenged, they degraded. When they were reintroduced to meaningful, targeted demand, they adapted. The timeline for improvements surprised even the researchers. Significant changes occurred in weeks, not years. This didn't mean everyone became athletic or fearless, but it did mean that stability, confidence, and independence were far more modifiable than previously believed. The implication was profound. Aging did not automatically erase the body's capacity to learn. It simply required the right input. The most important takeaway is not that these movements are magical or that they guarantee immunity from falls. It is that decline is not as fixed as we are often led to believe. The nervous system remains responsive far longer than most people assume. Balance improves when communication improves. Strength matters, but coordination matters more. Confidence returns when the body begins to trust itself again. None of this requires extreme effort or expensive tools. It requires attention, consistency, and respect for how the body actually functions. If there is one message worth remembering, it is this: instability is not destiny. Many people accept it because they are told there is no alternative. But evidence from around the world suggests otherwise. Starting small, moving deliberately, and challenging the right systems can change how you experience your body, even later in life. Progress doesn't come from pushing harder. It comes from moving smarter. And while no one can promise a future without risk, there is strong reason to believe that balance, confidence, and independence are still very much within reach for those willing to train what truly matters. Once you understand that inflammation is the hidden driver of heart disease, a question naturally follows. If this process begins decades before symptoms appear, why don't most people feel anything at all? Why doesn't the body scream for help sooner? The answer is uncomfortable, but simple. The kind of inflammation that damages arteries isn't loud. It doesn't cause pain. It doesn't trigger swelling you can see or discomfort you can point to. It operates quietly, below the threshold of sensation, while life goes on as usual. This is why so many people are blindsided. They believe that feeling fine means being healthy. They believe that passing routine blood tests means safety. But inflammation doesn't announce itself. It accumulates. And it does so in a way that tricks the brain into thinking everything is normal until the moment it is in single quotes T. One of the most dangerous myths about heart disease is the idea that it's a single event rather than a long process. A heart attack is not the disease. It's the final outcome of years of silent biological changes. Long before an artery becomes blocked, long before a clot forms, groundwork has already been laid through chronic inflammation that destabilizes plaque and weakens vessel walls. This is why two people with identical cholesterol levels can have completely different futures. One may live into old age without ever experiencing a cardiac event. The other may suffer a sudden heart attack in midlife. The difference often lies in inflammation. Cholesterol is the fuel, but inflammation is the spark. Inside the artery wall, cholesterol deposits can remain relatively stable for years. On their own, they don't always cause problems. But when chronic inflammation is present, those plaques become unstable. The immune system keeps attacking the area, releasing enzymes and chemical signals that thin the protective cap covering the plaque. Eventually, that cap can rupture. And when it does, the body responds as if there has been an injury, forming a clot to stop bleeding that isn't actually happening. That clot can completely block blood flow in seconds. That's the moment people recognize as a heart attack. But by then, the process has already been underway for years, sometimes decades. This is why waiting for symptoms is such a dangerous strategy. Symptoms mean you're late. High sensitivity, CRP, gives you a window into this hidden process. It doesn't tell you everything, but it tells you something incredibly important. Whether your immune system is in a state of chronic activation, whether your arteries are under constant attack, what makes this especially powerful is that CRP levels respond quickly to changes. Unlike cholesterol, which can take months or years to shift significantly, CRP can move within weeks. That means it can be used not only to assess risk, but to track progress. When inflammation drops, CRP drops. When inflammation resus, CRP resus, it's feedback your body gives you in real time. Many people are shocked when they first see the result. They're told their cholesterol is normal, yet their hs-CRP comes back elevated. That moment can be confusing, even unsettling. But it's also empowering, because it explains why something fell off, even when standard tests said everything was fine. It also explains why some people who do everything right still struggle. Diet and exercise matter, but they're not the whole picture. Sleep deprivation, chronic stress, untreated insulin resistance, environmental exposures, and visceral fat all drive inflammation independently of cholesterol. You can be thin and inflamed. You can be active and inflamed. You can eat well and still carry hidden inflammatory burden. This is why a one-size-fits-all approach to heart health fails so many people. Inflammation is personal. It reflects the cumulative effect of your lifestyle, your environment, your biology, and your history. Measuring it turns guesswork into clarity. There's also an emotional component that rarely gets discussed. Chronic stress doesn't just affect your mind. It directly affects your immune system. When stress hormones remain elevated for long periods, they push the body into a pro-inflammatory state. Over time, that inflammation becomes the background noise of your physiology. You stop noticing it, but it never stops affecting you. Sleep deprivation compounds this effect. Poor sleep disrupts immune regulation, increases inflammatory signaling, and raises CRP levels. It also worsens insulin resistance, which further fuels inflammation. This creates a loop that many people are trapped in without realizing it. Stress leads to poor sleep. Poor sleep increases inflammation. Inflammation increases fatigue and stress, and the cycle continues. Weight gain, especially around the abdomen, adds another layer. Belly fat is not passive storage. It actively secretes inflammatory chemicals that raise CRP and damage blood vessels. This is why two people with the same body weight can have very different risk profiles depending on where they carry fat. The good news is that inflammation responds to intervention at any age. Even in older adults, lowering CRP reduces cardiovascular risk. Studies consistently show that when inflammation drops, outcomes improve. This means it's never too late to benefit from understanding your inflammation status. Some people assume that medication is the only solution, but that's not always true. For many, lifestyle changes alone can significantly reduce CRP. For others, medication provides an added layer of protection. The key is personalization. Without measurement, personalization is impossible. There's another reason hs-CRP matters that rarely gets mentioned. It often rises years before imaging tests show problems. Arteries can look relatively normal on scans, while inflammation is already high. That means hs-CRP can alert you before damage becomes visible, before calcification, before narrowing, before emergency interventions. This early warning gives you something priceless. Time. Time to change course. Time to lower risk. Time to protect your future self before irreversible damage occurs. Many people only begin to take heart health seriously after a scare, after a hospitalization, after a stent, after a bypass. But inflammation doesn't suddenly appear at that moment. It's been present for years. The difference is that it was never measured. When people finally do measure it, the reaction is often the same. Why wasn't I told about this sooner? Why did no one mention this test? The answer isn't conspiracy, it's inertia. Medical systems change slowly. Guidelines lag behind research. And preventive care often takes a back seat to crisis management. But you don't have to wait for the system to catch up. You can ask, you can measure, you can act. Early? Knowing your hs-CRP doesn't mean something bad is inevitable. It means you have information, and information shifts the balance of power. It moves you from passive to proactive, from reaction to prevention. In Part 3, we'll break down exactly how to interpret your result in context, what numbers actually matter, how often testing makes sense, and how to build a realistic plan that lowers inflammation without extreme diets or unrealistic routines. Because knowing your risk is only the first step. What you do with that knowledge is what ultimately shapes your future. Until then, remember this. Your body has been communicating with you long before symptoms appear. The signals are quiet, but they are consistent. Measuring inflammation is one of the clearest ways to hear what your heart has been saying all along. Once you decide to measure inflammation, the next question is always the same. What do the numbers actually mean for you? Not in theory, not in a textbook, but in real life, with your history, your habits, and your future in mind. When your high sensitivity CRP result comes back, it's just a number on a page. On its own, it doesn't predict fate, it doesn't guarantee a heart attack, and it doesn't promise protection either. What it does is place you on a spectrum of risk and give you context that most people never receive. A low result doesn't mean you're invincible. It means your arteries are relatively calm right now. Inflammation is under control. This is where you want to be. The goal isn't perfection. The goal is stability. It's maintaining an internal environment where plaque is less likely to become unstable and less likely to rupture. A moderate result doesn't mean danger is imminent. It means your body is signaling that something is pushing your immune system into a higher gear. Maybe it's stress. Maybe it's sleep. Maybe it's insulin resistance, excess abdominal fat, or a dietary pattern that's quietly driving inflammation. This is the warning zone, the moment where small, consistent changes can make a big difference if they're made early. A high result doesn't mean you've failed. It means your immune system is actively engaged in a process that needs attention. It's a call for collaboration, not panic. This is where working closely with a healthcare provider matters, because the goal is not just lowering a number, but understanding why it's elevated in the first place. What matters most is trend, not a single snapshot. Inflammation fluctuates. That's why hs-CRP should be measured when you're feeling well, not during illness or injury. And that's why repeating the test after lifestyle changes can be so powerful. When the number drops, you know you're moving in the right direction. When it doesn't, you know something needs adjustment. This is where many people make the mistake of doing too much, too fast. They overhaul their entire life overnight, burn out, and quit. Inflammation doesn't require extremes. It responds best to consistency. Small improvements, sustained over time, change biology far more effectively than short bursts of intensity. Start with the basics, because they work. Food choices that reduce inflammation are not exotic. They're familiar. Whole foods, plants, healthy fats, less sugar, less ultra-processed food. These aren't trends. They're patterns that repeatedly show up in studies because they calm the immune system rather than provoke it. Thought movement doesn't have to be punishing. It has to be regular. The body interprets consistent movement as a signal of safety and resilience. Even walking shifts inflammatory signaling when it becomes a habit rather than an exception. Sleep is not optional maintenance. It's active repair. When sleep improves, inflammation often drops even before weight or cholesterol changes. This is one of the fastest levers you can pull, and one of the most underestimated. Stress deserves the same seriousness as diet and exercise. Chronic psychological stress is not just in your head. It alters immune function, hormone balance, and inflammatory pathways. Reducing stress doesn't mean eliminating problems. It means giving your nervous system moments of recovery, so inflammation doesn't remain constantly elevated. For some people, lifestyle changes bring hs-CRP down dramatically. For others, genetics or underlying conditions mean medication is part of the solution. This is not a failure. It's personalization. The goal is protection, not ideology. What matters is that the decision is informed. You're no longer guessing. You're no longer relying on reassurance alone. You're working with data that reflects what's actually happening inside your arteries. Right now, this is why measuring inflammation early matters so much. Not because it predicts the future with certainty, but because it gives you leverage. Decades of it. Time to intervene before disease becomes damage. Time to support your heart while the process is still reversible. Most people meet heart disease for the first time in an emergency room. They meet it in crisis, in fear, in pain. Measuring hs-CRP gives you a chance to meet it earlier, quietly, on your own terms, when prevention still works. If you take one thing from this entire discussion, let it be this. Heart disease doesn't begin with a heart attack. It begins with inflammation, and inflammation leaves fingerprints long before it leaves scars. You deserve to know what's happening inside your body. You deserve information that helps you act early instead of react late. And your future self, the one who still wants energy, independence, and time depends on the choices you make long before symptoms appear. If this helped you understand your heart in a new way, share it with someone you care about, not to scare them, to inform them. Because prevention is not about fear, it's about awareness. Ask the question. Measure the signal. Listen early. Your heart has been speaking long before it ever hurts.